Hi, I'm Nancy McGrath, and I'm here just to give a quick overview of the Emergency Department Approved for Pediatrics, our EDAP system, and the role of the Pediatric Liaison Nurse and how everything came about. Just to give a little history about emergency care, way back in the 1970s, just a mere 50 years ago, paramedic systems were first being developed. In 1973, the EMS Services Development Act started distributing federal funding for EMS systems throughout the country. And initially, the focus was on the big items: trauma, burns, spinal injuries, cardiac problems, poisoning, perinatal care, and behavioral emergencies. But interestingly, there was no mention of pediatric emergencies. So in 1978, the LA Pediatric Society, which was a branch of the California Chapter 2 of the American Academy of Pediatrics, and good old PTI, or the Paramedic Training Institute, which many of you may remember, along with LA County EMS, started to draw up guidelines for the pre-hospital care of pediatric patients, which then led to the first edition of this little blue book here, Pre-Hospital Care of Pediatric Emergencies, which again, if you've been around for a while, you may remember this was one of the little Bibles. So you can see that the groups that were involved were right here, and we really led and paved the way for pediatric emergency care. Moving on just a little bit more in terms of the timeline, in the 1980s, the trauma center designation started happening here in Los Angeles County. And this is just a map, and the red dots are all the trauma centers that we had at the time. In 1983, the implementation of the EDAPs and the Pediatric Critical Care Centers, the PCCCs at the time, which are now called PMCs, Pediatric Medical Centers, that all started developing in Los Angeles County. And at the time, of the 100 receiving facilities that were here in Los Angeles County, 77% of them participated. So we had great voluntary participation in this system when we first started. You can't talk about EDAP without discussing and mentioning the champions of the program. And in the middle here, we have Dr. Seidel, Dr. James Seidel, who really we think of as the father of EDAP, PALS, EMSC, pediatric emergency medicine, many, many things. And we would not be where we are today without his vision. And we also have Debbie Henderson, Dr. Deborah Henderson. Debbie is a nurse researcher who worked along with Dr. Seidel in publishing some of the first research on the care of children in the pre-hospital system. And of course, Dr. Marianne Gauchi-Hill, who will be speaking later today, who really has been the champion and has just taken over from Dr. Seidel and just taken pediatric emergency care to a whole new level. And she'll be speaking later on today on neonatal and pediatric resuscitation. So quickly, what is an EDAP? Well, an EDAP is a hospital that voluntarily, and I say voluntarily, meets very specific standards that are established for the care of children less than 14 years of age, less than or equal to 14 years of age. They have pediatric-sized equipment and specially trained staff to care for kids and address all of the unique needs of children, both medically and emotionally. And you're all here for your EDAP education. And so we know that you have an interest and a desire to make sure that you can provide the best care for your patients. Currently here in Los Angeles, we have about 40 EDAPs. It changes frequently. And we have one in Orange County, which is La Habra, and one in Ventura County, which is Los Robles. So 40, 42-ish, give or take, but 40 here in Los Angeles County. Why are we important? Why are EDAPs important? If you work in one, you understand it. But we know that the needs of kids are very different from those of adults. So having the equipment that we need and having the staff be better prepared to take care of children is of utmost importance. We know that children present differently. They have a very different spectrum of disease, and being aware of that and knowing how to manage that is extremely important. We know that they require specialized procedures and equipment, and everything that we do in pediatrics is kilogram based. Everything is weight based, sized based, and also you need to take into consideration the developmental stage of the child when you're addressing them and taking care of them. And so being in an EDAP, we're very, very familiar with that, and we're designed to really provide the optimum care for kids. And we know from all of the research that has been done that outcomes are much better for children when they are cared for by both physicians and nurses that are trained and educated to care for the child, both physically, emotionally, and on a developmental level. So what do EDAPs offer? Well, we've already alluded to the equipment. So we know that we have equipment that is very specific for pediatric patients. We have physicians and nurses who are trained and educated in both pediatric emergency care. You're here today at your EDAP course, PALS. And if you work in a trauma center, you receive additional trauma education in caring for the pediatric trauma patient. There's a medical director who's responsible for overseeing the entire EDAP program at each of the facilities, reviews the pediatric medical records. And we also have the pediatric liaison nurse who really takes on the majority of the responsibility for the EDAP system. It's involved in the quality improvement, education, maintaining the standards, and the equipment necessary to meet EDAP guidelines. So the pediatric liaison nurse, the role is multifaceted. The primary mission of the pediatric liaison nurses when this organization was developed in 1985 was to make sure that nurses throughout LA County received education on pediatric emergency care. And that has been our mission, and we have done that, I feel, very well over the past 35 years. We have had at least one course, if not 4 or 5 courses every year, and I think each year the courses get bigger and better, and I think most of you who have been to them can attest to that. We're responsible to oversee the pediatric equipment, making sure that we have what we need, the supplies and the medications, doing QI, quality improvement, and chart review, and giving feedback to our staff, and distributing that information throughout the facility to the other departments that are involved in taking care of children. We are involved in pediatric outreach, perhaps with another hospital that's near you that needs some assistance in caring for their pediatric patients. When we did the LA County Pediatric Readiness Project, we were partnered with smaller community facilities that are not EDAPs to help them improve their level of pediatric care. And it was a huge success where we went out and we actually did mock codes on site and chart review and helped them develop more policies and procedures. We also go out to nearby clinics, get involved in school activities with schools that are nearby. We did a lot of outreach at the local schools in Carson. And there's volunteer groups such as Scouts and things who will come and ask the pediatric liaison nurse to help with maybe a first aid class or moulaging and things like that. We liaison with the EMS agency as well as providing education to the pre-hospital providers who come into their specific facilities. The pediatric liaison nurse also attends monthly pediatric liaison nurse meetings virtually now. And it's a great opportunity to be able to share policies and procedures, QI information. We have our own projects that we work on in terms of our own types of studies. We collaborate on a variety of data points for EMS. And so it's a great way to connect and learn more about the role and have more sharing amongst the members. And then we attend quarterly EMS pediatric advisory committees at the EMS agency, where we advise the EMS agency on issues related to pediatric emergency care. And just to mention the Pediatric Advisory Committee, we were very instrumental in the formation of this committee in 2011 so that we could have a voice in the issues related to pediatric emergency care in the pre-hospital arena. And this is the sign that you'll see outside of EDAPs or perhaps on the entryway, which shows that this facility is an EDAP and it has met all the standards for EDAP designation. And this is the little EDAP there that you see. I have my EDAP air shirt on. These are some of the projects that we've been involved with over the years, way back to the very beginning in the early 90s, the LA County Airway Project, air transport, interfacility, a variety of things, as you can see. The big projects that we've been involved with were initially the Pediatric Preparedness Study, which was around 1999-2000 with Dr. Seidel and Debbie Henderson. And we were moved on to do the California Pediatric Readiness Project. We were the first in the country to do a readiness project, Pediatric Readiness Project with Dr. Kate Remick and Dr. Marian Gauchi-Hill, and where we surveyed 400 emergency departments throughout the state of California, and which then led to the National Pediatric Readiness Project, which is in its second phase now. And then we came back to Los Angeles and we did the Los Angeles County Pediatric Readiness Project, which finished in 2017. So we've been very involved in these pediatric readiness projects, and we continue to stay involved and participate in any way that we possibly can. Most recently, we were involved in the LA County EMS pediatric specific field protocols, so that we now have protocols for children in addition to the adult protocols. And Dr. Denise Whitfield will be here in another session discussing that. These are just some resources, websites, and organizations that are also involved in improving the care of children in emergency departments and in the pre-hospital arena. And basically, 35 years here we are. Our system continues to be emulated other places in this country. And though we're not a national certification, we are often called upon to help other counties and hospitals get ready for an EDAP type of survey. And, you know, it's just been a wonderful opportunity to participate in the EDAP system and the pediatric liaison nurses. And if you have any questions on the role of the pediatric liaison nurse, if you live in an area of the state of California or elsewhere in this country and you're interested in the role of this type of role, the pediatric liaison nurse or the pediatric emergency care coordinator, the PEC role, which is part of the National Pediatric Readiness Project, and we will see and learn more about that in the next couple of months. And in the next year, when we roll out the next phase of the Readiness Project, Dr. Kate Remick will be coming and be a speaker on one of the upcoming sessions, and she's going to talk about this role specifically. If you have any questions, please feel free to contact the Pediatric Liaison Nurses at PdLNweb@gmail.com. And if you need to contact me directly, please contact me at nancymcgrathrn@gmail.com. Thanks very much for your time.